The theory is they don't just develop, it's not like a heart attack. You get a heart attack on day one and you have a heart attack. MS may be slowly and insidiously developing over time and then just get to that one trigger point and suddenly there it is. It's very rare, I believe, and that most clinicians feel that way as well, that you just diagnosed and that's the day it started. It could have been for many, many years and mild. I've seen patients with sensory MS where they have a little numbness and tingling, or they develop a little facial problem, a little tic, a little numbness on the side of the face. Nobody bothers following up on it. A little loss of vision, which nobody followed up on. So MS just doesn't happen like that. It happens over time. The geriatric population, though, or anybody over 60, might very well just start having MS at that age, but it's kind of doubtful. And, we've learned a lot with what they call RIS, radiologically isolated syndrome, where a person has a migraine or has an automobile accident, and maybe they're in their 40s or 50s, and they do an MRI to check out for head injury, and there are lesions. So we really don't know, is MS diagnosed at a younger age? Had that person bopped themselves on the head? I don't know. Yeah, but yes, we are seeing them being diagnosed at older age, and we see them being treated very comfortably at an older age. That's a great question. Well, there are primary care of clinicians in the community, like a primary care doc or a NP or a PA, that may accidentally order some test just because there's some symptom, and then there it was. But most primary people are going to refer to a local neurologist or neurologic specialist. And I have a friend of mine who's an NP in Center State, Iowa, and he refers to a center, and he's diagnosed quite a few, but he sends them to an MS center, but then they come back and he knows how to manage them. But usually they go for second opinions to a larger academic facility or an MS specialist. Many of the primary care physicians or clinicians are not comfortable with these new drugs. I think they were more comfortable with the injectables. Yeah, but now, we're talking about Gilenya or Ocrevus or Tysabri. A lot of these drugs are a little tricky.